Hello, Facebook family. Hi. I think I am live. Let's double check this. Yes, we are. Okay. I see the first person on there. Hi, Kwame. Okay, so I am live. I'm back this week after taking an unscheduled Hi, Mommy, you're here too. Oh, hi, Elena. Hi, everyone. Sorry I had to skip on you last week. Duty called, hi, Busola. Duty called, I was on call, and I'm telling you, these babies just keep coming left, right, center. So I had gone in really early in the morning thinking I could be done with rounds and seeing everybody and maybe be able to carve out some time to talk to you, but wasn't able to. I think I gave you a heads up the week before. However, I had a feeling that it was going to be a busy weekend. So thank you for hanging in there and showing up this week. I thought I would try to see if I could get back to you during the week. But again, it was a little more hectic than I anticipated. So I figured we'd just pick up where we left off this Saturday. And hi, everyone. Hey, Dr. Sutton. Dr. Madeline, thank you for being here. Oh, I missed you guys too. I actually did miss you guys. I was like, oh, I hope they don't forget about me. All right. So I'll give a few more minutes for some more people to join in and so that we can catch up. I hope you guys had a wonderful last 2 weeks. I don't know what you guys got into. You can share in the comments if you want to. I had that week off to rest a little bit, so that was very rejuvenating for me, and then got right back into the swing of things this week at work. Let's see. Hi, Priscilla. Hey. All right, so for those of you who don't know the routine, when you join in, I love it if you could just put a hello or a hi or just post your name in the comment field, because I like to always come back and acknowledge you. And for those of you who will be watching this on replay, if you want to type in #replay, then I know to acknowledge you as well. And all through our conversation, you can post in questions, post in comments, post in ideas for things you want me to talk about, and I'll be more than happy to oblige. So, hi, Akos. Hi, the homie. Up there. Same. I just flipped it to one other side. All right. So, while we're waiting for others to join in, I'll just recap a little bit what we've been doing. I started off this series, back in May. And originally I started off with just, hi, Mrs. Lamte, my mother-in-law is here. I started off this series back in May with the plan to alternate topics between an obstetrics topic and a gynecology topic each week, and we did that for a few weeks, and then I started getting a lot of comments from you, all of you, requesting information more in the category of sexual health. So starting 2 weeks ago, I decided I would do a series of talks, the next few weeks, just go ahead and just focus in on sexual health a little bit. So that's where we are. I did a general overview 2 weeks ago. Unfortunately, last week, I wasn't able to join you. There were some pretty important new humans that wanted to join this world, and I had to be there for them. So it was my pleasure to do that. And we're going to pick up where we left off this week. So thank you for joining in. As usual, I'll start off with just introducing myself. I know most of you know me, but for those of you who are joining for the first time or who need to remember who I am Dr. Vanga. I'm your board certified osteopathic obstetrician and gynecologist, OBGYN for short. I'm here and I come here every week to talk to you. I also do this in my private practice, but I like to talk to women all over the world about myths that we have about our bodies, and I want to help to demystify them so that when we make decisions about our health, especially our gynecologic health or health related to anything obstetric, we can do so with more confidence, with more knowledge. And I have a lot of men who join me as well. I love it, love it, love it, because it tells me that you care about the women in your lives, and it can help you make decisions about your children as well. So, hi, Christy. Hi, Ophelia. Okay, so again, 2 weeks ago, we did a general overview about sexual health. And I want to sort of pick up from there. My plan had been last week to go ahead and talk about mamas, and sexual health related to pregnancy and postpartum interval, because I was going to be on call and that was going to be basically the realm that I was in. So I'll touch on that briefly during this talk today. But I have been inspired to focus a little bit more on a particular group of individuals this week. And it's mostly because, all over the news, we're hearing, at least here in the United States, we're hearing about, our children going back to school. And my nephew went back to school. I had to have a talk with him about a few things. And I figured this would be a great time to also focus maybe this lecture on adolescents and sexual health. So I know I have a lot of you who join me who are not adolescents. I do encounter a lot of adolescents in my private practice, so this is a conversation that we have a lot. But most of you have nieces, nephews, children who are in that age range. Now, I'm not going to talk specifically about our younger, children. I'm going to focus probably more on our 15-year-olds and above, and probably more specifically the college age and above today. Just some conversations that we should be open to having with them. So, hi, Dr. Stacy. Thanks for joining. All right, I think we've got quite a few people joining in. I appreciate you all being here. So, let me know if you think this is a great topic for you, if these are conversations that you've had in the past few weeks with your family members, and any interesting feedback you've had from that. Okay, I will go ahead, and I know this has been a bulk of the questions that I get. I'll go ahead and just let you know, next week we will talk about orgasms. I have had so many questions about that. So next week we'll talk about orgasms, okay? But this week we will focus on people who are transitioning a little bit. Our young people transitioning into like a mid-adult sort of phase, our adolescents, especially those that are going off to college. And then our moms, especially the new moms, because some of the moms, granted, a lot of moms who have had children before may know some of this information, but some may not. So this might benefit them as well. So, hi, Michelle. Okay, so I'll start off with my definition. Well, not my definition, but the definition I like, that I think best encompasses what sexual health is. We talked about this a bit 2 weeks ago, but it's the WHO definition. So it is a state of physical, mental, emotional, and social well-being when the term sexual health comes to mind. What are your initial responses to that? Like I said in our last conversation, some people, the minute you say anything that involves the word sex, there is an initial recoil, or no, we don't do that. Or others are like, tell me more. So we all have different responses when that term comes up. And that term is, that response is nurtured based on our initial introduction to the word. It's framed by our experiences. It's framed by positive and negative. It's phrased by our religious beliefs. And so we all come to this from different perspectives. And I'll try to be as all-encompassing as possible. Like I said, if you're one-on-one with me in the office, it's easier sometimes because I can kind of niche out where you're coming from and what your specific approach to the word is. and tailor this to you a little bit more, but in a broad context, you have to bear with me. I have to try to encompass everybody and everybody's beliefs about it. So, okay. Specifically related to this time of life where some of our children are going away from us. What I find when I get young people coming to me in the office is a lot of times nobody has ever really sat and had a conversation with them about their bodies, about their thoughts when it comes to sex, about what they're hearing from their friends, their peers, because a lot of times they end up learning more from their friends than from us, their guardians, their parents, their aunties, their uncles. So I feel strongly like there should be a framework available for us to be able to have these conversations openly and honestly. Because statistically, there's so much data that shows that when we're able to talk about this more freely, then we're less likely to make mistakes, less likely to find ourselves in compromising positions, and more likely to feel empowered when we find ourselves in some of these, in some uncomfortable situations. Knowledge is power, right? So I want to start today by just a basic anatomy lesson about the vagina. Sexuality is more than just the vagina, but that tends to be the crux of it, and that tends to be the most mysterious aspect of things for everybody, men, women alike. And I don't blame parents, adults all the time, because sometimes our experience or our exposure to it was lacking, so we don't really have the tools necessary to talk to folks about this. So I cheated. I went to medical school and learned obstetrics and gynecology, so I cheated a little bit. So I'll share some of the little nuggets that I know. Okay, so I debated whether to post a picture of the vagina. For me, that's not a problem doing that, but I do realize that for some people, it might be a little too graphic and in your face. So when this is done, I will post a picture in the comment field so that you can see the different areas that I'll be talking about. But for now, we'll use this to be our image of the vagina, okay? So vagina, area down in our pelvic area, that is quite a mystery to a lot of people. Different names people use to describe it. For me personally, I've chosen to when I talk to my children about it. I have young children, but I want to use the actual word vagina because I feel like it's a normal anatomy, and I feel like if we start using all these terminologies and coins and coined phrases and whatnot to describe it, it makes them already have this preconceived idea that this area is something we don't talk about. Now, this is not to say I think they should just go in vagina, vagina, vagina to everybody, all left, right, center, but I think it's the initial hurdle that we need to cross. And so that's my approach. So there are various areas in the vagina, and I think that once we know the initial anatomy of it, that actually leads us into more and more of knowing what it does, what it's capable of, all of that. So, there, Dr. Stacy used proper terms as well. Dr. Stacy is a pediatrician, and so I thank you. I feel validated then, knowing that you do that as well as a pediatrician. So thank you. All right, so absolutely, there's Dr. Madeline right there, another OBGYN. So yay, okay, I feel good about this. All right, so the vagina has various different aspects to it. So the outer part of the vagina, we generally refer to as the vulva, right? The area above the vagina, we refer to as the mons, okay? So when you first look at a vagina, usually the first things you see are the lips. You can call them the lips. And there are really two lips to it. There's the outer, which is usually a little thicker. It can be anywhere from about 1/4 inch to about 2 inches. Yeah. it varies. There's no one way that it's supposed to look. You know, some people see images of it in books, and we do have people come to the office to see us sometimes saying, mine doesn't look right. There's no one way that the vagina looks. There's various different ways. It varies in, you know, the way it looks. But basically, let's go back. There's the labia majora, which is the outer thicker lips. And then right inside to it, you have a thinner set of lips called the labia minora. Okay. For some people, the minora might be shorter than the majora. So they may be a little, you know, you may have to pry back the majora a little bit to see the minora. And for other people, it protrudes past. Normal. We all have different things. I may have smaller eyes than other people. Others may have prettier eyebrows. You know, we all have different labia majora and minora. Normal. Okay, so these two kind of are the doorways, I guess, to the vagina. Then right anterior to them, you have 3 different holes. Well, are there 2 holes or 3 holes? Good question. Somebody get back to me on that. Put that in the comments. All right, you've got your urethra, you've got your clitoral area, you've got your urethra. Right underneath it, you've got your clitoral area, you've got your vagina, and then you've got your anal area right down there. Okay, so the labia minora encompass what we call the vestibule. So the vestibule is that area right above there that has your clitoral hood and your urethra. When you hear the term clitoris, people sometimes imagine it to just be that specific point area right there on the top part of the vagina. It actually extends pretty deeply inside. And there are so many different nerves and blood vessels that feed into it from inside. So it's almost like it's just the opening to a bigger, mysterious, cavernous area, you know, that's just filled with blood vessels and nerve endings and everything there. So the tissue that covers the top of the clitoris is called the clitoral hood. And again, same thing here. Some people have a smaller one, some people have a larger one. With some, it protrudes out a little bit more. With others, it's just kind of flush. Okay, so then you've got the vagina. You also have 2 sets of glands that surround the vagina. So upper around the top part, close to the vestibule, you've got the Skene's glands. And then closer to the bottom, about midway to the bottom, you've got the Bartholin's glands. These are, and they are openings, basically. They're openings of what you see in those areas, but they feed back into glandular tissue. And these promote lubrication to the vaginal area. So there are sometimes where some people feel different bumps or lumps in the vaginal area, and it could be because one of those glands got a little blockage in it, and the lubrication that should be coming out is now backed up, and that can be uncomfortable sometimes because it rubs, it gets a little swollen and it rubs, and you know, we may just need to drain that a little bit for you. So and as we get older, sometimes we don't make as much lubrication from there. This all goes back to estrogen and all of that. Okay, so we've got labia majora, labia minora. We've got our vestibule that has our urethra, our clitoris, which comprises of a hood covering it and goes all the way, extends all the way back. We've got the vaginal opening. We've got glands at the top, which are the Skene's glands. We've got our Bartholin's glands, which are a little midway to lower part of the vagina. Bottom end of the vagina, you have a little piece of, a little area right there between the vaginal opening and the anus. And that little area there is called the perineum. Again, just as with everything else, I'll say it. Oh, yes, I'm going to address the WAP. I will get to that. Thank you, Naomi. Okay, so I will go back to that, I promise. So the area between the vagina and the anus is called the perineum. Again, just as with anything else, it could be a little longer in some people. It could be a little shorter. It could be a sensitive area as well. This area is important when it comes to vaginal deliveries, as we'll see later on, because if you get any tears or whatnot, that area could be affected a little bit. So I'll get to that. But just anatomically, we know that we've got the perineum right there. So let's see, what am I missing? Hymenal ring. Okay, so we hear about the hymen. We all hear about the hymen. Was the hymen broken? Was it not? Is she a virgin? Is she not? I think it was since we're talking about adolescents, I'm going to show my pop culture here. I still got it a little. But I know recently, I think it was T.I. came under fire because he talked about going to his daughter's gynecologic visits with her and asking the obstetrician to confirm that she's still a virgin. The hymenal ring is a circular area that partially covers part of the vagina, and it can be stretched, especially when you have a baby. It's definitely stretched to the point where it can sometimes get tears in it. When you first when you first have intercourse, it can be stretched to where it gets tears in it, but there are a lot of other things that can also cause that. Horseback riding, tampon use, any kind of physical activity can sometimes cause that area to stretch a little bit. So it is not an indication that someone is a virgin or not. So that myth really angered a lot of pediatricians and obstetricians and gynecologists. So it's just another anatomic piece there, but it's not, it's intactness. It's not an indication that you are a virgin or not a virgin. So there's that. Okay, so there was our anatomy lecture. We got all the different aspects to the vagina, and I think that as our children go off now to college, for those who rely on the school to give them their sexual health lecture, or somebody else to do it, it's important to just have this conversation and say, do you even know anatomically what your different body parts are? I mean, I think that is an area that comes under such questions during that independence phase of our lives, that knowing anatomically what it even comprises of is very important. Going back to what the homie told me to go back to, the glands that I mentioned, the Skene's glands, the Bartholin's glands, they have a lot of different functions. One of their functions is the lubrication that they make helps to get rid of dead cells. It helps to get rid of, bacteria, infection, things like that in the vagina. We all have normal bacteria. We all have normal yeast in the vaginal area. It helps to maintain the pH balance there. And when we do things like, get self-conscious and douche and use all these scented soaps and whatnot, that can affect the normal balance there. So that's when people start to get things like bacterial infections or yeast infections. I can't tell you how many young people I have coming to see me in their office who are just devastated because they think there's something horribly wrong with them because they've got a vaginal discharge that maybe has some odor or has some discomfort with it, or it doesn't look the way it's supposed to do. We're, as young people, we have vaginal discharge. Some people's vaginal discharge will be clear. Some people will be more whitish. For the most part, it doesn't have much of an odor to it. Some people have a mild odor to it, but again, if you are not in tune with your body and your anatomy, it might be something that you're not sure what your body odor smells like, for example. So when we're asking questions, how long has this been going on? Some people can't really answer, and then that sometimes hinders how well we can fully evaluate what's going on with you. But, I mean, granted, we have tests we can do to assess and whatnot, but knowing some of the history sometimes helps as well. Hi, Vivian. Hi, Prosper. Okay, so yes, the Skene's glands are supposed to make lubrication that helps to wash out dead cells, helps to maintain the pH balance, and helps when it comes to intercourse as well, so that we are supposed to have vaginal discharge. We're supposed to have a lubricated vagina when we're younger, and that does enhance when it comes to intercourse as well. So I'm jumping a little bit ahead of myself there, so I'll get back to that a little later when we go more into intercourse. So questions about any of that at all? I'm going to challenge you guys today, because usually I wait for you to put the questions on there, and people have been doing this. Okay, dear Borna, dear. Okay, yes, I mean, I saw that. So being in tune with your normal vaginal anatomy, when you start encountering things like bumps or lesions or discharge or odors or things like that, then you're able to point out, okay, this wasn't there before, this was there before. But if you just completely ignore that area, then you're not able to pick out on those things. The reason why that's important is because, okay, let's go with the labia, for example. So I talked about different sizes, different shapes and whatnot. There's also different colors based on your race, as we mature, it changes color sometimes. Sometimes some people will get little lesions or bumps there, and if they don't pay attention to it, then that could develop into something else. We can get moles in that area. We can get ingrown hairs for those who shave or wax. And about that, there's no right or wrong when it comes to that as well. There's no medical reason why you have to do one or the other. It's a matter of preference. Some people prefer to shave and wax. Some people prefer not to. That's fine. It doesn't hurt anybody. Okay. As long as you keep proper hygiene. But sometimes you can get ingrown hairs. And for those who do start engaging in sexual intercourse, if they start getting lesions that are, representative of being exposed to things like herpes or and whatnot, if we pick it up the first time around, sometimes it helps to be able to prevent more serious consequences. When it comes to the vaginal discharge, for those who start engaging in intercourse, if you're not familiar with your normal vaginal discharge, the odor, the consistency of it, you can get things like gonorrhea, chlamydia that may have some symptoms that we could have picked up a little earlier on. And the earlier on we pick up these things, again, we can usually treat these very easily with antibiotics. But if it gets to be a more raging infection that travels up inside the uterus, then you start getting conditions like pelvic inflammatory disease, which can cause scarring in the uterus and eventually affect your fertility. So there are some, it sounds pretty basic to say you need to know your anatomy, but knowing the anatomy is pretty basic. So we should know it. Okay, so about that. Good. I don't see any questions on here about the anatomy. Maybe this is basic to a lot of you, which I'd be happy about, because that means that you're aware of it, you're aware of yourselves, and you'll be able to talk to your nieces and nephews and children about this. Okay. Then the reason why I think it's important talking to our young people about this is, for people like me, I grew up in Ghana, West Africa, and I went away to boarding school when I was 10. So being away from home at a young age, the advantage to that is when I eventually moved to the United States when I was 19, it wasn't such a drastic thing, to where I'm like, oh, I can go crazy and wild now because this is my first time away from home and I have no restrictions. I was already used to not being at home all the time. For those who are going away for the first time, some of you may have gone through that same experience, but your children may not have. So they may be going away for the first time now. There is that sense of independence and freedom that some children will go through. I say children, but really they're young adults, will go through the first few times they're going home. But even before that, increasingly we're seeing a lot of middle schoolers and high schoolers who are engaging in intercourse, engaging in and by intercourse, there's a whole broad category. I'm not talking just about sex, about vaginal sex. We're talking about oral sex, anal sex, vaginal sex. They're engaging in all of these things without really fully knowing the repercussions of it. So starting a conversation in a very innocuous way about just anatomy helps us sometimes break some of that tension and makes them know that they can come to you with questions about it when the time comes. So I think I pulled up some statistics. I like to always throw in some statistics there, and I have to look at, hold on, I wrote it down right here. It says 47 in the United States, 47% of children in a survey that was done in children 15 to 19 years old had engaged in some form of intercourse. It didn't say vaginal intercourse, it just said some form of intercourse. That's 47%. I always take statistics with a little grain of salt, because this is usually going to be people who are motivated to tell the truth, because not everybody will tell you the real truth. But if you think about it, 47% of people in the survey that was done had engaged, from the age 15 to 19, had engaged in sexual intercourse. So our teenagers, our adolescents, they're going through this, and if we're not talking to them about it, they start to form some habits that can be lifelong. Maybe they end up having positive experiences, but there could be a lot of detrimental experiences that they can avoid if we start having these conversations with them. The other one I wrote down was, I think if we do have the amount of teenage pregnancies that occur, 2% of people who have children as a teenager by the age of 30 have still not completed college. So the earlier they end up getting pregnant, and especially if it's an unplanned pregnancy, the less likely they are to complete their at least college education. It was 60% when it came to high school education. So empowering them by letting them know about their anatomy, about what its function is, and what we can do to hold back the function of some of the aspects of it, really could be life-changing for them. In the United States, in the last few years, statistically, the rates of teen pregnancy have gone down. And that's great. It's gone down almost 50% in some age groups, some teenage age groups across the state. But that's been because of the introduction of contraception education. So sticking our heads in the sand and not talking about it is not going to take the rate down. Again, 47% are having sex, whether they're talking to us about it or not. They're talking to me about it. So we found that statistically, if there's a parent or a guardian involved in the conversation, they are more likely to not get pregnant, or if they do go ahead and engage in intercourse, they're more likely to practice safe sex. So just a little bit of information for you to ponder on. Okay, what do you recommend is an appropriate age to have the sex talk with a child? I have my personal opinion about it, but I think that definitely by that age 15, you should probably have had some sort of conversation with them, because these children are being introduced to this a lot at much younger and younger ages, through their friends, through social media, through interactions, and they're hearing positive and negative things. They're hearing truths and myths, mixed in there. So the individuals in your life better. So there are some children that you could tell, if you're honest with yourself, need to have that conversation earlier. And there's some that may be able to wait a little later. But definitely, if you have a child that's leaving your household to go away to school, be it high school, be it middle school, be it college, I would think that you should probably have some form of conversation with them about that. Because curiosity is a natural instinct. And as they get exposed to things, they will want to find out more about it, and who better to guide them through that than you. It's different from like it being a history lesson where you feel like you're not well equipped to give that history lesson, so you rely on the teachers to do that. There's some things we can entrust our educators to do, but there's some other things that are probably best if we do that, or a trained professional does that, in that. And I think this is one of those areas. So my personal opinion, again, like I said in the beginning, I use normal verbiage when it comes to, our anatomy with my girls. I say breast, I say vagina, I say things like that. Not everybody's comfortable with that, but that's my personal opinion, and I explained a little bit about why I feel that way. So, okay. Any other questions? All right, I'll come back to them again later. For those of you who didn't know what I was talking about or what the homie was talking about on there when she mentioned WAP, you may need to up your cultural pop references. I'm proud of myself for knowing what this one is. It's a reference to a well lubricated vagina. And it was popularized recently because of a song that came out by Cardi B, featuring Megan Thee Stallion. Yeah. And so it's all the talk and all the rage now on a lot of social media platforms, TikTok and Instagram and even Facebook and whatnot. So if you have teenagers in your life, you may want to ask their opinion about that. That might be the start to a conversation about that. Okay. All right. So as our children go away from home and they go to college, they go to some go to middle school, some go to high school outside of home, especially in this era when there's so much, we're doing so much more online, they're getting exposed to a lot of virtual stimulants. I never heard of it, Vivian. Well, okay. We will talk later, Vivian. Okay. And you have young boys too, so, you're sheltered. My teenagers, I learned a lot from my teenage patients and my college age patients. I've made it a point at the end of every visit with them to, kind of challenge them to teach me something. I'm like, well, I taught you all this stuff. What could you tell me? And sometimes I learn some interesting things. So it's important to have that. I like having that rapport with them so that we can talk about stuff like that. And so I can keep up to date. So, okay. All right. Started this conversation off again, explaining why I think this is important. We talked about anatomically what the vagina looks like, so that we can maybe over time start to learn more of the function of it. And I explained that I want to tailor this specifically to our adolescents who are going away from home, simply because I think that there are a lot of pitfalls that they might be exposed to that we can help them avoid if we start having these conversations. One of the things that happens sometimes when they go away, and again, I'll go back to my college age kids, when they go away to college, is, they get exposed to people from so many different backgrounds that may be similar or different to what the background that they've grown up in. And there's so many positives that can come out of that, but and a lot of negatives. And one particular negative that can come out of that is if they start to have any self-doubts about themselves, or they start to lose their self-confidence, start to have curiosity about certain things, and start to go down a route that ends up being unhealthy to them. We all know about alcohol and drugs, and the war on drugs is a big thing. Well, it's been usurped a little bit by the pandemic, but it's still been a big problem in all communities, I would say, to a certain degree, especially so in the westernized communities. So they'll get exposed to some of these things, and they might find themselves in, social situations where, they get offered a drink. They don't know to protect their drink, keep their drink with them, keep it covered up, because people slip things in people's drinks, and they may unfortunately find themselves a victim of sexual assault. I think it was somewhere in the aspect of 9% of college age children may have been exposed to some sort of sexual violence. And even more so, they might find themselves engaged in a relationship with another person who then uses their lack of self-knowledge as a way of controlling them. The more empowered our children are, the more empowered we are about knowing what our bodies do, the less likely it is that somebody will be able to use that information to trick us. I jokingly threw out the whole the 2 holes or 3 holes thing. That's one of the questions I like to challenge my young people about, and you'd be surprised how many don't even know how many holes there are in the pelvic area. You've got your urethra, you've got your vagina, you've got your anus. So it's 3 holes. And this is something that a lot of people get tricked up on, and oh yeah, I know, and then find themselves in this situation where, just to prove how cool they are or how in control they are, they go along with a lot of peer pressure things that result in them being violated. So let them know about this stuff. Talk to them about being on college campuses. And if you do, not to say don't go out and have fun, don't do that in this COVID era, but in normal era time, if you're going, making sure that you have a trusted friend, ideally of the same sex, that goes with you, that checks in with you every 15 minutes if you guys get separated during the party. For moms who have children going away, and even for children who are in things like cheerleading camps and all of that, who go away periodically, one of the things I encourage you to maybe set up with your children is a safe word. And this is for your children that may have cell phones where they're able to call you, to where if they find themselves in compromising positions, they can just call you and maybe just use a trigger word. You know, your safe word could be something like book. You know, so if your child calls you and just says, hey mom, remember that book I was talking to you about? The minute you hear her say that book, you know that she's in a situation, she or he are in a situation where they need you to come and get them immediately. You know, no questions asked. What I encourage with that safe word thing is the underlying, the underlying agreement, the unspoken agreement should be, if your child calls you with a safe word, you do not punish them for it. Because if you do, they're less likely to call you next time they find themselves in a compromising position. But if they know that they can call you and you can rescue them and save them from this compromising position that they found themselves in, they will do it. They will call you. And this could potentially be life-saving. So establish a safe word with your children as they go away. Good to know that some people are talking about this. Yeah, this is, I think this is, you can make up the whatever word it is, you know, and they can either text it to you or, you know, call you and immediately say that. You can have other trusted adults if you're not in an area where you'd be within driving distance to them. Other trusted adults that live close by or something like that, that they can call, or they can establish this with their girlfriends or their close friends that are near them, to establish safe words so that if they find themselves in compromising positions, they can do this. Something simple like walking home from a college campus, from the library, from a job, from whatnot, and walking home late at night, making sure that they know to maybe have somebody on the phone. That a lot of our young people want to just put their music on and just walk around with their headphones on and music, and they have no peripheral knowledge about what else is going on around them. And that can be compromised. That can be scary, you know. So ideally, maybe they should call somebody and be on the phone with somebody so that, you know, during the entire walk home or whatnot. Let's see, what other issues can be encountered on college campuses. Yeah, I think those are probably some of the highlights of that. Let's see, rape, violence, contraception. I mentioned before that one of the reasons why teenage pregnancies have gone down is because the conversation about contraception has been had. So if you're comfortable with that coming in, and a lot of OBGYNs will be very comfortable having the conversation with a parent or a guardian in the room. But at some point, we may ask you to step out so that we can have a frank conversation with your child as well and address any questions that they have that they might not be comfortable talking to us about with you there. I do this. I know I have friends who have mixed opinions about this, and they're like, why are you talking to my child about something without me there? I wouldn't have to do that if you were having frank conversations with your children. I've had so many young people, when I offer this, say, oh no, I can talk to my mom. I can talk with my mom in the room. And that is so heartwarming to me. Like, I literally tear up when that happens, because I pray that my children will be that comfortable with me. And I'm hoping that I'm setting the foundation that they will, that they don't have to talk to somebody without me there. They feel safe to talk about this stuff with me present as well. So just because we ask you to step out, your child can say no, and they do say, oh no, I talked to my mom about everything. I talked to my dad about everything. That's the most heartwarming thing to me. I'm going to tear up right now, even just thinking about it. So, have these conversations with them so that we can all, as a team, work together to make sure that these young people are growing up with strong sense of self-esteem and nobody can lie to them or take advantage of them, and they're empowered enough to stand on their own. Okay. Anatomy, statistics, dangers of college, teenage pregnancy risks, sex, drugs, alcohol. I don't know a whole lot about drugs. Drugs are an area that I'm a little naive about. So I know there's several different ones. There's prescription ones that some children will get, and they use that as an excuse. Well, it was prescription. It was prescribed by a doctor. It's safe to take. No, it's not. Letting them know that these things are out there. Some college students will take this stuff to help them learn, to stay up late at night, to study harder. I was fascinated the more I learned more about some of these, but this is out there, and it's a big industry, and there are people out there just taking advantage of our children. And so us having these conversations with them, because they take these drugs, they don't know how their bodies are going to respond to them. Some people end up unconscious. We all saw that story of the college student who unfortunately was on the lawn, and the young man took advantage of her there with other students around. Oh, and that brings me to another thing. Teach them, if they see something bad, to say something about it. Say something to somebody about it. Don't walk past. Be your brother's keeper. Be your sister's keeper. Report it to somebody. Report it to your parent. And your parent should report it to the school or something. Let's look out for each other's children as well. Okay. So, I'm starting to preach a little bit here. Okay, so anatomy, having the conversation with our teenagers about going away, all the different risks that could come up from that. And in that process, maybe learning something ourselves. I said next time we'll talk more about what you guys have been privately sending me messages about, the orgasm and the whole mechanics aspect of things. But we're delving just gradually. We're just peeling back some of these layers and talking. So today we're talking about adolescents, and I wanted to also touch on our mamas. So for those of you who are, for those of you who have had children, for those of you who are pregnant, for those of you who have people in your lives that are pregnant right now, that some little pointers that you can give to them. So obviously, to get pregnant, you have to have had sex. So they obviously know about the mechanics of sex. They might not know all the different nuances of it, but they know the mechanics of it. So during pregnancy, people go through pregnancies differently. Some people have very easy pregnancies, is what I call it, when they don't have any complications or they're able to still perform most of their normal activities. Some people have, pain and discomfort and nausea and vomiting and whatnot. So for those who tend to be in better control or who are feeling more like themselves during pregnancy, usually sexual function doesn't tend to be as much of a problem based on what their baseline is. There's some people who are concerned about having sex in pregnancy, and I get a lot of moms who are like, oh no, we're not doing that. It's okay to have sex while you're pregnant, as long as you don't have any medical conditions that predispose you to preterm labor, or bleeding. So, for example, if you've been told that you have a placenta that is covering your cervix, either fully or partially, one great follow-up question, because OBGYNs are human and we should tell you this, but every now and then we may not say specifically because we assume which we shouldn't. But you can explicitly ask, am I allowed to have sex or not? And we will tell you yes or no. If your water breaks too early, you don't want to have sex because, there's nothing protecting the baby. If you have had a lot of bleeding because you have a placenta that has separated a little bit, so something called an abruption, that might be another time that we might restrict you having sex during pregnancy. But otherwise, for the most part, most people, or you have a shortened cervix, so your cervix is either prematurely dilated or thinned out, that might be another time. But for the most part, it is safe to have sex during pregnancy. You may have to experiment with different positions, because as the uterus gets bigger, that might get in the way a little bit. So that's when, you guys can strengthen your union by having fun with it and experimenting in different positions. A little later on, maybe when we talk about more of the mechanics of it, we'll talk about different positions and Kama Sutra and all that fun stuff. Resources for you. Let's see. After having, and some people will report that their sexual drive increases, especially in the second trimester. So that is a thing. There are people who have more vivid dreams, who have never really been ones to initiate, who start to want to initiate. These are all normal. There's nothing unusual about it. But again, if you have, a lot more discomfort and pain and pressure, and, some people get swollen in the vulva because the baby's sitting in a position that causes a lack of drainage of the lymphatics, so they can get more swollen down there. Sometimes that might be a little uncomfortable, so I can certainly understand that. And you can use things like maternity belts during the day. That helps to lift the baby up and decrease some of the engorgement sometimes, mechanically. So there's that. And then postpartum is the area that I like to really talk about. Postpartum, once you've gone through, I'll go with vaginal deliveries first. Once you've gone through a vaginal delivery, as we talked about, you could get tears in the vagina, tears obviously in the hymenal ring, and sometimes you can get tears down the perineum. Remember that area between the vagina and the anal area. So you can get some tears there, either because you tore naturally or because your baby is a little bigger and your doctor had to help out by cutting an episiotomy. We don't do as much episiotomies lately, thankfully, but every now and then we may have to, just to get the baby out quickly, or to prevent you from having a more extensive spontaneous tear. So after a vaginal delivery, we typically encourage you to not have sex for at least 6 weeks. And this is usually because once your cervix has opened to let a baby out, it stays open for a little bit longer. And I mentioned we have normal bacteria, normal yeast in the vaginal vault. Having intercourse can sometimes introduce some of these into the uterine cavity, so you'd be at risk of, an infection in the uterus. We call that endometritis. So if you can give some time for the cervix to close back up, for the uterus to shrink back down, so that there's less risk of that is most ideal. So that's the main reason why we usually recommend that you wait a little bit. I always think it's funny when I have moms that come in and they sheepishly go, "No, we've already done it. It's okay. Just, if you're having any symptoms after that, don't be embarrassed to bring it up to us." But there is a reason why we recommend that. Also, if you've had a C-section, it's probably ideal to wait a little bit for intercourse, simply because you've had an incision not just into your skin but into an organ underneath you, and you want to give time for that to heal. Some people can have orgasms that are so strong that it causes the area to spasm and can cause some pain that's significant. You don't need to go through that if it's not necessary. So there's a benefit to waiting a little bit to let yourself heal. It's just 6 weeks. Okay, so let's see. If you have a tear or a cut into the perineal area and it needs stitches, it can feel numb sometimes initially, but some people will have persistent pain in those sites for a while, and that can be detrimental to intercourse as time goes on, because they shy away from it, and then that area scars down, and because it's not stretched out enough, that can be a source of, I think in one of the lectures before I talked about something called vaginismus. So that's one potential cause of that. So if you are having any residual pain or discomfort in that perineal area, or even in the vaginal vaults, because you can get tears in the labia as well. If you have any residual all right, if you have any residual tears there, any residual pain from tears there, bring it up to us so that we can help, with some techniques and things like that to help stretch that out. I like coconut oil for stretching that out a lot. I mean, it's a natural lubricant, and if it absorbs into the skin, that's something that is not detrimental to you. Let's see, I'm going through things in my head right now that I want us to talk about. One big thing, for those who choose to breastfeed after having a child, when you're breastfeeding, I like to explain this way. When you're breastfeeding, your body feels like I'm feeding a child, so I'm not ready to make another, right? So sometimes your lubrication decreases. You don't lubricate, you don't make as much lubrication from those skenes and Bartholin's glands as you did before. So vaginal dryness while you're breastfeeding is normal. It's normal. I get a lot of people coming in afterwards to say, I have pain now with intercourse and it's uncomfortable. It's because you don't have as much lubrication. I encourage all my moms to just invest in lubricants postpartum if you're breastfeeding. There's nothing wrong with it. There's nothing that says that there's something abnormal about your body. There's a lot of different kinds of lubricants out there. Uber tends to be a very well-liked one. There's platinum lube, there's momentum lube. I had to shout that out. There's a lot of different lubricants out there. There are vaginal moisturizers you can use as well, and this is not like I equate them to like lubricating, moisturizing your skin. So one that I like is called Hyalofem. So these are conversations you want to have with your OBGYN as well if you're having residual issues related to this. But vaginal dryness while you're breastfeeding, very, very common, expected, and you can use lubricants while you're breastfeeding, and that doesn't mean that your body changed or you're different and you're ruined. Yeah. Okay. I think that is pretty much what I wanted us to go over today. I wanted to talk about our mamas because I was taking care of moms last weekend, which is why I couldn't be with you. And I wanted to talk about our adolescents because they are going off to college and schools, and some are going in person. So I always think it's great to have those conversations with them. Next week, I'm going to delve into the meat of it, what you guys have been asking for, and talk about the big O. And then I will also want to talk about something that's near and dear to me, our youngest women, as they transition into what we call menarche, as they start to go through the physical changes of transitioning from being little young girls into, teenagers, and the developmental things that they go through, so that we can have some tools to talk to them about as they go through that transition, and maybe how I plan on talking to mine about that, or how I've been talking to mine about that. Okay. All right. I will look through and see if we have any questions. Again, anyone that was joining in, please put your name in the comments. I'd like to acknowledge you. If you're watching this on replay, type in #replay. If you have questions, if you have suggestions about topics that you want me to address specifically, please do so. Post them in the comments. Send me a private message. A lot of you do that, and I will definitely try to put them in there. I'm so happy you guys got to be with you guys this week again. I missed you last week, and I do plan to continue this series for a few more until we exhaust all your questions. And then once we're done with that, I'll go back to alternating topics between the obstetrics and the gynecology topics. So thank you. Once again, I'm Dr. Vanga, your obstetrician. I'm Dr. Vanga, your board certified OBGYN, here every week through this forum to break down myths about the female body so that you can make healthcare decisions with more confidence and feel empowered with the knowledge, and through that method of find your voice as well. So you're very, very welcome. Thank you for being here with me. Thank you. Bye. Have a wonderful week.